Traditional healers in Bushbuckridge, up in Mpumalanga, of course, can now help diagnose HIV. It's an initiative by a Wits University research unit. Now, according to WHO, HIV, of course, remains a huge global public health issue, and an estimated 39 million people are living with the virus. Remember as well, during COVID-19, nobody was really talking about this, but this is important. Let's get the latest in this development. It's a huge pleasure. I'm joined by Dr. Ryan Wagner, Senior Research Fellow at this Wits Research Unit. Now, the reason I keep leaving out the name Doctor, good to have you on the show, and I apologize for taking more calls. Thank you for your time. How do I say this research unit's name? MRC Wits, it sounds French. How do I say this properly? Good morning.
Good morning. Thanks, Gareth. Agincourt.
Agincourt.
Agincourt is the name, and it's a research unit that's been doing population-based research for the last 3 decades, actually, in rural Bushbuckridge and Mpumalanga. And as part of that, we've done work with traditional healers over the last decade or so, in some work called Interessano, which in the local Xitsonga language means working together.
Okay. And why Bushbuckridge? Why that part of the country? Because HIV is a global issue. It's a huge issue around the country. Why Bushbuckridge, if I may?
Yeah, that's a great question. And it's a little bit just fortuitous and entrenched with the history of South Africa. And so Wits University has had a long-standing relationship with hospitals and health facilities in that area, stretching back to the mid-1980s. And so through this work and from this, the Agincourt unit began.
And I see it's now helping diagnose HIV, and I always want to be very careful, clear when we talk about diagnosing of HIV, because I can see I'm going to get people on Twitter saying that traditional leaders can't cure HIV. That's not what we're talking about.
No, that's not what we're talking about at all. And in fact, what we've done with traditional healers, and this is a partnership between the researchers at the MRC Wits Agincourt unit, the Department of Health, and traditional healers in the area, to actually train traditional healers on HIV testing, counseling and testing, using the traditional methods that one would see or use at a clinic or a health facility. And so it is, empowering these healers, these leaders, to test individuals, and then with that partnership, enroll them in care at the local health facilities.
Because I do want to talk about the cultural elements of this, and I'm curious as to when you mentioned, and we were talking about Bushbuckridge, so the traditional, more conventional, I want to be careful with my wording, more conventional ways of diagnosing and testing for HIV.
Sure.
What I think is curious here, and tell me if I'm on the right track, Doctor, is many people in some of the rural areas don't trust what they would call Western clinics, normal clinics. They stick with their traditional healers because their family has stuck with the traditional healers. There's a trust there in these areas, and I suppose that's what you're trying to get across.
That's absolutely right. So there's certainly a level of trust and respect that these healers hold in many of these communities. It's also an access issue. So a lot of folks will struggle to get to the clinics. We all know that the prices of petrol and taxi fares are going up. And
when
so
the taxis are actually running as well.
That's right. That's right. Yep. And so in order to access care, some of the first people that they'll turn to are these healers. And so we actually see a lot of use of both healers and biomedical facilities. And the idea with this work is really to empower the healers to realize that they can play a role in the delivery of good care, and to break down some of the stereotypes that I think do exist in some of these rural communities, whether it's individuals towards healers or healers towards biomedical practitioners. And the idea is to work together, given kind of the limited resources, to improve the lives in these rural populations.
I would contend as well this could be a great litmus test for the rest of the country. Yes, Bushbuckridge, very populous as well, very well-known area of Mpumalanga. But could you see this happening elsewhere around the country, or perhaps that's even the goal?
Yeah, absolutely. So that is the long-term goal. I think the first step in this is proving that it's feasible, proving that traditional healers and folks in the Department of Health are willing to kind of work together. And I think we've seen that over the last several months and years with this work. And then the idea is the extension. Firstly, to all of Bushbuckridge. We only trained 15 healers in this first feasibility study, but to extend it to a larger population population would be the idea. And then, you know, within and throughout South Africa and perhaps other places on the continent where healers are prevalent and respected members of the community.
I always get a sense as well in this particular aspect, you want the rolling stone to gather moss, because the more traditional healers you can get on board, have that trust built with them, those traditional healers are going to tell other traditional healers as well. I imagine that's the kind of rolling moss we're looking for here.
That's absolutely right, and we've seen that. You know, we started with 15 healers, and we trained them, and they've been able to test over 400 individuals already to test for HIV, and we've diagnosed a number of new cases. And the idea is that kind of rolling stone model. And anecdotally, you know, we have had other healers come up to us and say, how do we get involved in this research? You know, how can we be trained as well? And it's not just HIV. I mean, HIV is a huge focus in these communities because of the huge burden. And there was a recent systematic review done showing that undetectable levels of HIV result in untransmissibility, and the recent review in the last week or two on that. And so really it's about identifying the cases that haven't accessed a traditional health facility to see if we can pick those cases up and get them on treatment.
And I imagine as well, whenever we talk about HIV in South Africa, and you'll know this better than anyone, we're always going to bring in TB as well, tuberculosis as well, one of the most easily treatable but non-treated diseases in our country. While we're looking at some of the visuals, Doctor, of the traditional healers in this case, when you talk about partnerships, how do you try and scale this up? You mentioned government, you mentioned provincial health departments as well. How willing are they to take this to the next step? Are you getting a sense you're moving in the right direction?
That's a great question. So at the local level, so the sub-district and district level, we've had huge support for this work. And in fact, we recently did a small video, which you can find on our website, where the sub-district manager was interviewed, and he's been hugely supportive of this work since the very kind of genesis of it. And so engaging, you know, at a higher level is something that we're working towards, that we've begun. And I think it's really about showing that this is feasible, showing that it's possible, and showing that the key players are willing to kind of come to the table in a way. And so certainly, I mean, this work, we see ourselves as a catalyst for this work. You know, the key partners are really the healers and the Department of Health, and it's forming that partnership and kind of, again, showing that this work is possible.
Let's try and help catalyze this a little bit further, just as I say goodbye to you, Doctor. Where can I send people if they want more information? Perhaps there's other health departments watching this, other clinics around the country going, you know what, I've never even heard of this, or I have heard of this.
Sure.
I don't even know how to get hold of someone involved in this. Help me as I say goodbye. Where do I send people?
Sure. So we have a website. So we're doing this work under the auspices of Wits and the MRC Wits Agincourt unit. But our website is www.wits.ac.za/Ntirhisano.
Well, you're going to have to spell that for me.
I am, yep.
Yeah.
Ntirhisano. Ntirhisano. And again, it means working together, and that's really our aim with this.
Yeah, it's a great way to describe it as well. Doctor, we're going to, I'm sure, have this loaded on YouTube a little bit later as well. By the way, anyone watching, if you want the details, you can go ahead and tweet us. No, sorry, X us these days. And we'll try and get that on social media as well. Doctor, great work. Thank you so much. All the best. And I really hope this is scaled up as well, because it's incredible work. Dr. Ryan Wagner, a Senior Research Fellow at the MRC Wits Agincourt Research Unit. I've learned a new word today. Very, very fancy.